Good afternoon or good morning, everybody, wherever you're joining us from across Canada or across the world. My name is Matthew Mulkern. I am the Vice President of the Canadian Association of Road Safety Professionals, and I will be moderating this webinar on behalf of Brenda Suggett, our wonderful Executive Director, who couldn't make it here today. I'd like to welcome everyone to this webinar. It's entitled Patterns and Changes in Risk of Motor Vehicle Casualties Before and During the COVID-19 pandemic. And before we introduce the presenters and just do a little housekeeping, I have to give thanks to the sponsor and funder of these webinars. The webinars are part of the Knowledge Exchange and Training Hub program, which is generously funded by Transport Canada. So we thank Transport Canada for their funding in order to provide this webinar. We will have the presentation, and then we're going to have time at the end for questions. We really look forward to your questions. We just ask from a housekeeping perspective that you please use the Q&A box on your Zoom screen to ask the questions, and we'll do their best to, if they're directed to a certain panelist as well, please include that in the question. And now I'd like to introduce today's speakers for the webinar. First, we have Dr. Evelyn Vangelis. She's the Director of the Population and Community Health Unit and Professor Emeritus within the Departments of Family Medicine, Epidemiology, and Biostatistics at the University of Western Ontario in London. Her two main research programs are Injury Prevention and Control and Mental Health Substance Use, with particular focus at risk youth. We also have Dr. David Byrne. He's the team leader in the Research and Evaluation Office at the Ontario Ministry of Transportation, where he leads several applied road safety research projects in the areas of commercial vehicle safety, alcohol, drug impaired driving, and aggressive driving. He also received his PhD in computational neuroscience from McMaster University. And our last panelist today is Dr. Mark Rappaport. He's a professor and residency program director in the Geriatric Psychiatry Division of the Department of Psychiatry at the University of Toronto. And he's also the past president of the Canadian Academy of Geriatric Psychiatry and acting head of Geriatric Psychiatry for Sunnybrook Health Sciences Center. So we're definitely so thankful to have such three wonderful and knowledgeable panelists today, and I will turn it over to them to let them begin the presentation.
Thank you. I would like to start off and get the, okay. Having problems advancing here. I'd first like to acknowledge our wonderful group of co-investigators on this study. Now, the objectives for today will be reflecting on trends and patterns of Ontario motor vehicle collision casualties. We'll be comparing the injuries, the casualties for younger and older drivers. We will be presenting analysis of possible shift in relative riskiness during the pandemic, and then we look forward to having a discussion with you and your thoughts on policy recommendations on the findings. To start off, we all know that almost 3 years ago, the World Health Organization declared coronavirus disease a pandemic, and we know that in the initial months, we saw a rather dramatic decrease in mobility, which moved up and down around the world and has now come back to pretty well normal levels. And we also know that when we have economic downturns, which the pandemic caused, we also have decreases in motor vehicle collisions. Now, an OECD report examined a number of countries and examined 2020 compared to 2017 to 2019. And most countries that they examined showed a decrease, and that decrease continued in 2021. Although some countries, notably the US, showed an increase for both 2020 and 21. Now, in Canada in 2020, we also saw a decrease in motor vehicle fatalities compared to 2019, although the number of fatalities per billion vehicle kilometer traveled did increase. We did see a decrease in the number of serious injuries, but an increase in the percentage of occupants who were injured not wearing seat belts. Now, our focus was on higher risk drivers. We all know that we have a U-shaped curve when we talk about higher rates of motor vehicle fatalities for both younger and older drivers. Although we need to be mindful that the differences in crash rates between groups may not necessarily reflect variation in exposure. It can also can reflect variations in conditions rather than actual tendency in increased crash risk, because we have the low mileage bias and also the frailty bias to consider. Now, we do know for younger drivers, they are higher collision, injury, and fatality risk compared to older groups. And predictors, we have found many studies. We've got age, gender, inexperience, and immaturity as key predictors of higher crash risk. For older drivers, we have to be mindful that by 2040, we will have nearly double the number of senior citizens on the road. And age is the highest risk factor for dementia, so we have to be mindful that we will have a high proportion of licensed drivers who may develop dementia. As part of this study, we reviewed the literature on types of driving errors that are more common among older drivers with dementia when we compared them to controls. And when we look at older drivers versus drivers with dementia, the differences we found in studies were increased variability in speed, lateral lane position, headway distance. We found a number of driving errors, particularly focused on turning, lane observance, traffic lights, and also they generally traveled with lower speed, although a couple of simulator studies found that there was a greater percent of time found speeding in the simulator studies and increased number of speed accidents. Now, we're focused on a higher risk driver during COVID because these two age groups may have been changing their driving behavior during the pandemic. There was some early research showing that with younger drivers, there was increased speeding and intention to drink and drive compared to older drivers, and a couple of studies we found for older drivers, and they found that they drove less, took shorter trips, had lower injury and fatality rates during the pandemic compared to before the pandemic. So the purpose of our study was to examine trends and patterns of Ontario's motor vehicle casualties, which included injuries and fatalities before and during COVID. We compared younger and older drivers to middle-aged drivers, and we also analyzed relative riskiness of drivers during the pandemic by age group compared to before the pandemic. So I will now ask Patrick if he can move on to reflect on the method section.
Thanks, Evelyn. So I will share my screen here now. If you just give me one quick second, try to make this as quick and painless as possible. Okay, I think that's worked there. Okay. All right. So as Evelyn was saying, we wanted to look at the riskiness and how that changed in relation to the pandemic and the various lockdown measures that occurred, and specifically how any changes that were induced by the pandemic, affected different age groups of drivers differently. So in order to do that, we first constructed quarterly time series for a number of outcome measures that were based on police-reported Ontario fatal and injury and motor vehicle collision data. We use quarterly time series. Normally, we want to do this kind of analysis with monthly time series since, changes happened in the pandemic quite quickly. But because of data restrictions, I'll talk about in a moment, we had to restrict ourselves to quarterly analysis. And we also use police reported collisions because a lot of our analysis depends on understanding who may have been at fault in a collision. And so police reported data actually involves police being at the scene of a collision and filling out a collision report. And so we get higher quality information for some data fields that way than we would for, say, self-reported property damage collisions. When we constructed our quarterly time series, we took data ranging from the first quarter of 2010. So we got a good historical baseline that way, excuse me, and went right till the first quarter of 22 inclusively, which was the most recently available collision data that we felt was of sufficient quality for analysis. And we created separate time series for different age groups, 16 to 24, 25 to 34, et cetera. You can see them all here. And we wanted to also create time series for novice drivers as well. Again, unfortunately, because of data limitations, that wasn't possible. One of the challenges when we want to look at how something like COVID would have affected riskiness of drivers is trying to get measures of exposure. So how much driving is actually happening, vehicle kilometers traveled, that sort of thing. That data is challenging and expensive to get at the best of times, especially if you want to break down, by driver age and vehicle types or things like that. But also because policy measures to combat COVID changed fairly rapidly on a month-by-month basis throughout the pandemic. We'd really want fairly fine-grained time or temporal data for exposure. And I mean, it's not possible to get that. So essentially our outcome measures were all of the proportional or ratio kind. So the idea is that, if we're interested in drivers speeding who are 16 to 24, we might count up how many 16 to 24-year-old drivers were speeding in a given time period in a collision, and then normalize that against the denominator, like, all 16 to 24-year-old drivers in a collision, with the idea that both the numerator and denominator would be equally affected by changes in exposure. So it gives us a measure that hopefully is insensitive to changes in exposure and can tell us more about risk. So where it was possible, we analyzed these time series using ARIMA-based interrupted time series models, and we tested interruptions. So we looked for pandemic or pandemic countermeasure effects in the second quarter of 2020 and the first and second quarter of 2021. So obviously the second quarter of 2020 was the first quarter where there was a real COVID pandemic going on, and where, there were stay-at-home orders and lots of businesses were closed and things like that. So the first sort of lockdown that happened in Ontario. And similarly, there were policy lockdowns essentially in the first and second quarters of 2021 as well. And interestingly, the Bank of Canada produces a stringency index that measures how severe COVID countermeasures are, how restrictive they are at any given time. And if you actually look at that stringency index, you'll see peaks in the index at each of these quarters as well. We also wanted to do additional analysis looking at different regions of Ontario, try to correlate some of our outcome measures with things like vaccination rates, case counts, all of that sort of good stuff. But again, as I'll explain in a moment, we had some data restrictions that prevented this from being possible. So I keep talking about outcome measures. Now I better tell you what they actually are. So first of all, we looked at the quarterly count of collision-involved drivers by collision severity. So that's not a proportional or ratio measure, but it's going to give us some important information. Then we looked at the ratio of drivers in single motor vehicle to multi-vehicle collisions. And the idea here is that, single vehicle collisions have all long been looked at as sort of a proxy for how risky a driver group is. So if, 16 to 24-year-olds have a very high single to multi-vehicle collision ratio, it might mean they're riskier than other groups. The challenge here in using this during the pandemic, of course, is that you'd expect this ratio to sort of increase as exposure goes down, because vehicles have less of an opportunity to encounter each other. But as we'll see when we look at the data, this doesn't really happen for all age groups. It only happens for some. So it gives sort of what we believe is a good relative measure of what happened to risk in different driver groups during the pandemic. Next, we used a quasi-induced exposure-based measure of riskiness. And so for those of you who aren't familiar with quasi-induced exposure, essentially what it does is it looks at driver involvement as not at fault. So drivers who are involved in collisions but are not at fault as a measure or a proxy for exposure. So you're just driving around, you get hit by somebody. It's an indicator that you're out there. Whereas drivers who are at fault are indicative of risk. So in other words, if we do something like, say, take the number of 16 to 24-year-old drivers who are considered to be at fault in collisions over a given time period, divide that by the number who are not at fault, it gives us this thing that we call a fault ratio. Other people might call it a collision involvement ratio. But that ratio tells you how risky that driver group is relative to a driver from the general population. So if you have a fault ratio of 1, you're just as risky as a general driver. If you have a fault ratio of 2, your group is twice as risky. And when I say risky, I mean likelihood of causing a collision given the opportunity. There's a lot of math behind that. I can share some great studies with people who are interested if you want to reach out. We also looked at the proportion of collision-involved drivers with alcohol or drug involvement, and this is, of course, motivated especially by findings from the US, where large increases were seen there. And we looked at the proportion of collision-involved drivers who were speeding over time. So first, what I want to do is just have a quick look at these absolute counts. So if you just look at the right, what I've plotted here is the number of drivers involved in fatal or major injury multi-vehicle collisions in Ontario by quarter. So a fatal injury collision is a collision where at least one involved person dies within 30 days. A major injury collision is a collision where at least one involved person is admitted to hospital. And so you can see that, there's lots of noise in this time series. It was actually quite tricky to model. Modeling it suggested that there was an initial 25% reduction in the number of drivers involved in these collisions quarterly. I think that may be a bit of an overestimate, or just because the modeling was again a bit challenging. And the modeling also indicated that this returned to baseline within 1 to 2 years. I'm just going to show you, I'm just going to smooth that out for you so you can kind of see that trend a little bit. When we looked at drivers involved in minor injury collisions, it was quite a bit different. So these collisions are all collisions where somebody in the collision is injured, but they don't have to be admitted to hospital. But they don't include things like property damage collisions. This data was very amenable to modeling. It was no problem to model this. And what the model showed was that at the beginning of the pandemic, which is this first orange bar here, there was a 56% immediate reduction in the quarterly number of drivers involved in collisions, in these minor injury collisions, with an enduring 42% reduction that doesn't seem to be returning to baseline. So, I mean, the question is here, how to interpret this data, right? We have a situation where there's relatively minor decreases in major injury collision involvement and relatively short-lived, whereas there's relatively large decreases in minor injury collision involvement that seem to be sustained. There's two, I think, classes of explanation for this. One is that somehow patterns of vehicle kilometers traveled, so patterns of exposure changed, or riskiness levels of different driver groups changed in such a way that minor injury collisions just became less common, whereas major injury collisions were relatively unaffected. You have to do a few mental gymnastics, I think, for that to make a whole lot of sense. Another possible explanation, of course, is that it may be that minor injury collisions somehow became less likely to be reported throughout the pandemic. And we have some anecdotal evidence from the US and even Canada that some of that may have happened. And I'm not going to speculate on the causes as to why that happened, but there are some sensible reasons why it could have. For example, drivers may not have been as willing to call police to a collision scene because they're afraid of interacting with people and catching COVID, just as one potential explanation. Why is this important? Well, if we look at alcohol involvement in fatal and injury collisions, so all fatal and injury collisions, we actually see that there was a relative increase at the beginning of the pandemic. But if we restrict our attention to fatal and major injury collisions, we see there was a fairly substantial decrease during the pandemic. So we get these two sets of data. They're telling us something that is sort of inconsistent. And usually you think of alcohol involvement as well as being related to the more serious collision outcomes. So is it really the case that, alcohol involvement just became more common with minor injury collisions and less common with major injury collisions? It's possible. Yeah, it's also possible potentially that there may have been some underreporting of minor injury collisions that was less the case if those collisions potentially involved something that could be criminal or illegal, like alcohol involvement. The real challenge here, though, is we don't know. We don't know why the minor injury collisions seem to have changed very differently in the pandemic than the major ones. And so just to play it safe, we decided we had to restrict analysis moving forward to just relying on fatal and major injury collisions, because we're pretty confident that those things, when somebody dies or has to be admitted to hospital, those are going to be well reported. So this unfortunately led to a lot of loss of statistical power and some questions that we could investigate, but at least we can be confident that what we find is likely very meaningful. So the first thing I want to talk about now is what happened to riskiness of 16 to 24-year-old drivers. If we look at this single to multi-vehicle collision ratio, we actually see that it increased by about 30% in the second or third quarter of 2020. Now we have to be careful here because this wasn't one of those hypothesized interruptions that we were testing when we thought things might change. So this is sort of a post hoc thing and maybe spurious. But it is interesting that this is kind of probably around the same time when there was an initial wane in the pandemic. So we're not sure if that's related or not. What's really important, though, is if we look at the fault ratio, we see that there was a sustained 57% increase in the riskiness of 16 to 24-year-old drivers when the second wave, essentially, of the pandemic hit. You might look at this and think, well, this sort of increase over here on the right is within kind of the range of variation of what's been going on everywhere else in the past. But there really was a decreasing trend leading up to here. And the modeling tells us that this 57% increase was unexpected. And not to prove it, but just to illustrate to you, I actually just did some smoothing of the data. And this is just a sliding average. And so you can see that increase is there. And to my mind, this is one of the most important findings we have, because there are a couple of important points. I mean, one is that this risk is increasing. It shows no sign of returning to normal. It's a substantial increase for these younger drivers. And what's really interesting is that we weren't able to identify a single cause for it. When we look at all the driver actions and conditions and things that we can find in a police collision report, none of them changed proportionally. So it indicates to me anyway, or I think to anybody, that really it was just a general increase in riskiness of these drivers, not a specific bad behavior, but just a lot of potential bad behavior. I should also note as well that in Ontario, of course, drive test centers closed down throughout much of the pandemic. And so people who had novice license classes were unable to upgrade to a full driver's license during much of this period as well. You could imagine that what that results in is fully licensed drivers actually on average increase in age throughout this period. And novice drivers are in a situation where they're subject to novice restrictions in our graduated licensing system program for longer. So you'd almost expect a decrease risk for this driver group because many of the 16 to 24-year-old drivers are novice. But we don't see that. An alternative possibility, of course, is that those young drivers just drove less and gained less experience. And so, when the pandemic started to wane, perhaps their risk increased. We really don't know. It's pretty speculative, but it's definitely something that I think we need to continue to watch. And unfortunately as well, because of the restriction to fatal and major injury collisions, we weren't able to separate out the data for novice and fully licensed 16 to 24-year-old drivers. So now I just want to move on to the next driver group, which is 25 to 34-year-olds. We actually didn't see any change in riskiness for this group of drivers, whether we look at the single to multi-vehicle ratio or the fault ratio. It almost looks like a bit of a decrease here, but you have to remember that that's relative to the average driver at the time. So a decrease could also be staying the same while everybody else got worse. Either way, nothing concerning seems to have happened with that group overall in terms of riskiness. What sort of surprised us a little bit was that when you look at 35 to 54-year-old drivers, if you look at the single vehicle to multi-vehicle ratio, you don't see a lot happening here. There is maybe visually you see a little bit of an increase in that ratio. But with the fault ratio, there is a statistically significant sustained 22% increase in riskiness for this group. And I mean, we initially had thought of this group as sort of our control group that you know, we would measure everybody else against. But it seems that they got riskier relative to the average driver during this period again. And you know, what I think is particularly interesting here is just like with the 16 to 24-year-old drivers, this actually started in the second lockdown period. It didn't happen right away. So I'd really be interested later in people's thoughts on why these increases in risk seem to be happening later in the pandemic as opposed to at the beginning. When we look at 55 to 64-year-old drivers, essentially statistically, we don't see anything. There's a lot of variability, but no indications of any increase in risk associated with the pandemic. There's this funny little blip of a spike in fault ratio before the pandemic. Our best explanation for this is that it's spurious and that, you know, if you cut your data in enough different directions, you're always going to find things jumping out that might not actually mean much of anything. Nothing that we know of could have led to this that we're aware of, and it happened again before the pandemic. So we're going to say, you know, for 55 to 64-year-old drivers, really not much changed in terms of riskiness. 65 to 79-year-olds, similar. Nothing really happened with the single to multi-vehicle ratio. Nothing really interesting happened with the fault ratio. And finally, when we go to 80-plus-year-old drivers, the fault ratio here, if we look at that first, you can see on average it's quite high. Actually, it's well above 1, which is not surprising. It's understood to be the case for this group. They tend to be a little bit riskier. But there's too much variability here for us to do proper analysis. However, if you look at the single to multi-vehicle collision ratio, again, there's a lot of noise here, but there was definitely a statistically significant increase in this measure of riskiness for this age group. But once again, I mean, it seems to occur starting at the second lockdown. So again, not in the initial phase of the pandemic, which is quite interesting, I think. I'll come back in a moment and sort of summarize all these results because I've thrown a lot at you. But in the meantime, what I want to do next is move to looking at speeding. So why drivers may have become riskier. What's interesting is this light blue line, or this data represents the proportion of collision-involved drivers who were at fault for some reason, who were at fault because of speeding. So if we look at like 16 to 24-year-old drivers, one of the groups where we saw elevated risk, probably the strongest evidence of elevated risk, there really is no change in that speeding proportion, no dramatic increase throughout the pandemic. If we look at 25 to 34-year-old drivers, this one's kind of concerning in a way because it suggests there's been an ongoing increase in how much speeding these guys have been doing, but nothing associated specifically with the pandemic. The one that I really want to draw your attention to, though, is the 35 to 54-year-olds. This was the group where we saw in the second part of the pandemic, at the second lockdown, they showed a statistically significantly elevated riskiness as measured by the fault ratio. And it's also in the second part of the pandemic in 2021 where we see a real jump in the proportion of those drivers who were involved in collisions and were at fault due to speeding. So that was an interesting finding that maybe it's really the 35 to 54-year-olds who are actually doing some of the more serious speeding. If we turn to alcohol involvement, we had findings here that are very inconsistent with what was seen in the US. Regardless of what age group we look at, so all these colors, of course, represent the different age groups, we see the proportion of at-fault drivers who had alcohol involvement actually decreasing even possibly before the pandemic, but certainly throughout the pandemic. We don't have any solid reason for why this is happening, but I would note that at the end of 2018, beginning of 2019, mandatory alcohol screening was implemented in Canada. And so that's federal legislation, of course, that allows a police officer who has lawfully stopped any driver to use an alcohol screening device to test them for alcohol, regardless of whether they have any reason to suspect alcohol involvement or alcohol use. That may indeed have led to this decrease or contributed to it. I like to think it had. The interesting thing, though, is, I mean, if I hadn't worked in this area, I don't recall seeing much in the way of public messaging about mandatory alcohol screening. I don't know if others have, but it strikes me as something that could be a great public education opportunity. If we can, sort of build on this potential success from that legislation, if indeed that is what's happening. Drug involvement. We don't see any really clear pattern here throughout the pandemic. One of the challenges with drug involvement, at least in Ontario until this year, is that police can only code a driver as alcohol impaired or drug impaired, but not both. And so, of course, there's going to be a tendency to use alcohol impaired because it's just much easier to detect and much easier to demonstrate. So, there's some question as to how meaningful this data is, but we didn't see any, concerning increases or anything. In terms of older drivers, as Evelyn was pointing out, we were concerned a little bit about cognitive impairment and, the effect the pandemic may have had on the mental health of older drivers. And so one of the ways that cognitive impairment might manifest is through a lot more collisions that involve making a left turn, because it's one of the more cognitively complex things you can do when driving. So you can imagine driving up to a street trying to turn left. Unlike a right turn where you just have to watch one traffic stream, with a left turn, you have to watch at least two different traffic streams, look both ways and potentially integrate information about oncoming traffic from both directions. So there's a lot of cognitive and perceptual processes involved in that. And so we tried to look for any increases in the proportion of drivers who were turning left during COVID. And what's interesting is for the younger drivers, we don't see any changes as we would expect. For 65 to 79-year-olds, we do see a statistically significant increase of 55%. For 80-year-olds, we also see a 39% increase. It doesn't achieve statistical significance, but we think that's just because of low numbers, like it's a power issue, but you can see it really mirrors what's happening to the 65 to 79-year-olds. But again, I would point out here, what's surprising to me is we saw for all the other driver groups, any increase in risk seemed to happen during the second half of the pandemic, whereas this left turn proxy actually showed spikes in the first component of the pandemic in 2020. So we're not sure what to make of that, but it is sort of hinting perhaps at some cognitive issues. And the final thing we had to look at was pedestrians who were seriously injured or killed. We looked at all the different age groups that we looked at for drivers involved in fatal and major injury collisions, plus some younger age groups. Fundamentally, when we looked at the data, we saw no real statistically meaningful changes in risk associated with the pandemic, except for 16 to 24-year-old pedestrians being killed or seriously injured. That seems to have gone through about a 49% reduction at pandemic onset, a little bit more of a reduction at the second lockdown period, and some recovery afterwards. The numbers are a bit too low to investigate in detail because, again, we're looking at fatal and serious injuries. But it does seem that perhaps this suppression was related to fewer fatalities and major injuries to this pedestrian age group on evenings and weekends. So perhaps there were fewer places to go at night. So just a quick summary of our results. We see indications of risk elevation in the pandemic for 16 to 24-year-old drivers, 35 to 54-year-olds, and 80-plus-year-olds. Surprisingly, the risk elevation seems to begin later in the pandemic at the second lockdown. I'd written here that this might possibly reflect initial exposure reductions, I don't actually believe it anymore because, I mean, the measures we used were built to be robust to changes in exposure. So I'm not sure that that actually provides a very good explanation as to why we see that increased risk for those 3 age groups late in the pandemic instead of early in the pandemic. I think statistically, we see the best evidence for an increase in risk for 16 to 24-year-old drivers, which seems to be persisting. And, we really need to keep an eye on that, I think. The causes of increased risk are definitely different for different age groups. So for example, for 16 to 24-year-old drivers, we weren't able to identify a single cause. Rather, the risk seems to be spread across all kinds of different driver actions and conditions and circumstances. Most surprisingly, in a way, is the 35 to 54-year-olds, where it seems the increase in risk was associated with speeding for the most part. Possible cognitive issues for older drivers, but again, the timing where we see the elevated risk, as indicated by the single to multi-vehicle collision ratio and the left turning proxy, don't really quite line up. So maybe probably take a little bit more data. We may have to wait a little longer to get some sort of deeper certainty on that. So some of the other points that I want to make involve the difference we saw in minor and major injury collisions. It's really unclear why minor injury collisions changed in a way that was so much different than the major injury collisions. We don't have the right data, it doesn't seem, to determine with any kind of certainty if that was a real change in the way people drove or patterns of exposure, or if there's some sort of thing happening that prevents less severe injury collisions from being reported. We have to keep an eye on this, obviously, because we wonder, with all the papers that will be coming out about COVID and all the ongoing road safety research everyone is doing, will this create some sort of long-term challenge or build some bias into the analysis that road safety researchers are doing with collision data in the long term? And it's important, I think, because, we would rely on simply fatal and major injury collision data if there was enough of it. But when we want to ask a lot of different questions, we need to sort of broaden the base of data we're using. And so, for example, we couldn't look at novice 16 to 24-year-old drivers versus fully licensed 16 to 24-year-old drivers because we just didn't have sufficient counts. We couldn't fully investigate what was going on with the 80-plus-year-old drivers. We couldn't look at regional analysis in the province and correlate with those other things that we wanted to, like vaccine uptake and case counts, or really do a deep dive investigation into the effects that some of the COVID responsive driver testing policy and training policy had on road safety. So that sort of summarizes the results I wanted to present. And what I'd like to do now is just turn it over to my good friend, Dr. Mark Rappaport, so he can just remind you of, or give you some conclusions and maybe lead the discussion a little bit in terms of a question and answer session. So thank you.
Well, thank you, Patrick and Evelyn, for outlining this work. It's very interesting. The minor, as I'll just highlight some of the things that, at the risk of being repetitive, that Patrick mentioned. The reduction in minor reporting, in minor collisions, likely has to do with reporting, but we don't know, and it's a mystery as to why that why those seemed to be so much fewer during the pandemic. I think so we relied in this presentation on major collisions and fatalities, which by definition are less likely to be affected by reporting because these are major incidents. What we learned is some interesting facts about demographics and about potential causes, some potential theories, and we have to be tentative here. But the novices, there was an increase in single over multiple collisions. That's a really neat proxy because presumably a single collision would be more likely to be at fault. And in fact, in those novices, there was a 57% increase in the fault ratio. So that was in the second wave. In the first wave, there was the increase in the single over multiple. So, why might that be? It didn't seem to be speeding for those novices. The speeding seemed to be the 35 to 54-year-old group. This was a group that had in the second lockdown a 22% increase in single over multiple vehicle collisions. Now, why is that specific to that age group alone, 35 to 54? We don't know, but the fact that this occurred in the second lockdown or after the second lockdown is interesting because I'm remembering that in the first lockdown, people were mostly working from home. A lot of offices had shut down in Ontario. And then with the second lockdown, after the second lockdown, people started to venture back more into offices. They were open. And so this 35 to 54 group representing the working, hardworking demographic who are also caring for kids who are returning to school and driving them to school and driving to work, then we start to see that increase, and because the roads were less populated, there was more opportunity for speeding than there would have been pre-pandemic with traffic congestion. Though that's just a conjecture at this point. The older age group, which is the group that I'm most interested in, the 80+ group, the sample size is small, so we see a lot of noise in that data, as Patrick pointed out. And there was a signal of left-hand turns, which our systematic review led by Saya Bayat from University of Calgary indicated left-hand turns were one of these proxy markers in older adults with dementia that differentiates older adults without dementia. So in the 80+ group, numerically and graphically, it seemed to increase. It wasn't statistically significant. It was significant in the 65 to 79-year-old age group, at least in after the second lockdown. So why is it that there was a slightly increased risk of single over, actually not slightly, we had a 76% increase in single over multiple vehicle collisions in the 80+ group? We're not sure because the sample was too small to really examine that, but that's something we'd like to really look at over time. There are a lot of opportunities that this pandemic as a natural experiment gave to us. In a sense, the Ministry of Transportation of Ontario's 80+ driver renewal program was put on hold. A lot of the driver testing for young people was put on hold, at least at the beginning. And so could it be in the 80+ group that a lot of people who would have been assessed every 2 years with some cognitive screening at the Ministry of Transportation, could that have led to an increase in that age group? Also, we know that people 80+, as all Ontarians, were not seeing their doctors for non-urgent matters during the early stages of the pandemic, and so there wouldn't be an opportunity, for example, in an 80+-year-old to see their doctor, to have an opportunity to do a cognitive screening in the doctor's office, or for the doctor to notice that someone is failing cognitively because they weren't seeing them in person, and sometimes they were just connecting by phone, which is a very limited way of assessing people. So those are just some comments, and we really want to leave some time for questions and to try our best to answer and to hear your ideas about what implications there are of these findings, particularly with regard to policy.
Well, thank you very much, everyone, for your presentation. Very good, Evelyn, Patrick, and Mark. I would again emphasize at this time, if people have a question, if they could direct it in the Q&A. Just one question that came up through the Q&A box already, and that has been answered, but maybe since not everyone is looking at the Q&A box, and maybe we could just talk about it anymore. This is a question that was directed to Patrick. And Patrick, if you just want to just say what you said on the chat here, that the question was, were there or will there be further geographical data analysis based on postal codes from the collision reports?
Yeah, I mean, that's a really great question. I think, initially we really wanted to do that kind of thing because, case rates in different parts of the province were different from each other. Restrictions in different parts of the province may have varied from each other somewhat from time to time. Vaccination rates may have differed, and it was possible to get all that data so that we could do that kind of analysis. But the unfortunate thing that we couldn't do is actually come up with enough collision data to spread that thin, just again because we had that restriction to fatal and major injury collisions. But yeah, I mean, if we eventually develop an understanding of what was going on with the minor injury collisions, then I think that that's certainly something that's worth coming back to and investigating further.
All right, thank you. Okay, so we have a few more questions here. So let's go to the next one. I guess this is kind of directed to all the panelists, so anyone who wants to speak up can. The question reads, have you considered looking at the results of the COVID survey in Ontario by Evelyn and all regarding differences in amount of driving, self-reported speeding, drinking and/or drug-impaired driving, involvement in collisions, perceived police enforcement activity as a function of age groups, and comparing them to the collision results? Big question there.
I leave that for you, Evelyn.
Well, I think our group has been thinking about it. I mean, right now, as Patrick said, we have not been able to disaggregate MTO data because we have a numbers problem. We don't have enough in different groups. Now, we do have, with our survey, we certainly have regional breakdown so that we could look at regions and what was being responded to regionally, but we just can't, we don't have the MTO data to do that. What we have found, though, apart from the 34 to 54-year-olds, we are seeing some congruence. So certainly we did find that the 16 to 24-year-old groups in our survey did self-report greater speeding, drinking, driving, etc., more police stops and more collisions. So there actually is some congruence there. The 34s, it's at the 54-year-old, there isn't any congruence, and we did find that with the older drivers, the older the driver, the less likely they were to say they were on the road or they had lower exposure. So there is some overlap with what we found and the MTO data. There are some limitations as to what we can pull together, but we are certainly looking for opportunities where we can blend the two studies. I know our group, Patrick, Mark and I have been kind of talking about places where they can. So indeed, we are looking for those opportunities, and wherever we can, we'll be trying to mirror them, because it said one is collision data and the other is self-report. So there can be a nice congruence in some areas.
All right, thank you. And then there's another question here, and I think, well, not just COVID, this question seems to come up a lot in regarding a lot of different studies, but the question reads, concerning the young 16 to 24-year-old drivers, is there anything that can be done at a school level to help reduce the numbers you presented?
So I'm assuming this means we're talking high school here. So I'll go with that assumption. I think one of the challenges there, of course, is that there's probably a lot of groups that want to have high schools teach content on a lot of different issues. So sort of working into schools is probably never an easy thing to do. But what I would say is at the ministry, I mean, we have beginner driver education programs that we sanction, and we are always actively looking at those programs to attempt to make sure that the curricula of those programs better match what's happening in the real world. And so this data will absolutely feed into any ongoing review we do of those programs to assist novice drivers in terms of learning why they need to be safe, how to be safe, what needs to be done. And then hopefully they can take that and move forward into their driving life and retain some of that information.
Thank you. I will use this chance to ask everyone one last time if they have any questions, please to put in the Q&A box. I do have a question while I give a chance for people to ask any last questions. My question, we had just talked about this before the presentation, so I think it's good to share with everyone. If we compare your research that you've done here to some of the other studies available in terms of timing, in terms of the length of the study in regards to the pandemic, how does this kind of compare with the other research that's currently out there?
Well, I've been reviewing a lot of the studies that have been done. And actually, I'm very proud of the work that we have done, because most of what's out there is descriptive, pre-post, in very short pre-post windows, 30 days before, 30 days after, 50 days before, 50 days after. So they have those pre-post windows. There's virtually nothing that has long time series. You really can look at the trends and really model the trends. We know pre-post, the kind of pre-experimental design pre-post is the weakest of designs. Obviously, it's important to look at preliminary data, so it's very useful. But I think that the fact that Patrick used such a long time series to really model the potential changes that occurred during COVID, I think is very powerful. Number two, I could not find any studies that actually looked at different age groups. A couple of studies may have done in a regression analysis, may have looked at 2 or 3 age groups, but we actually modeled over time different age groups. So that is, I think, very interesting and very strong. Number 3, we looked at different types of driving behaviors. Again, most of what I've seen is overall fatalities, and then they might put in some predictive variables in a regression that could be speeding, that could be impaired driving. So the fact that we actually have trend data for this, I think, is also very powerful. And then finally, the fact that risk is examined in relation to COVID, that I've not seen done anywhere. So to me, I think that we have a lot of interesting data, unique data and analysis that were conducted with this data set that I have not seen so far in my scan of the international research looking at COVID and road safety.
I'll just add as well that, as you know, Evelyn, that our earlier work from a couple of years ago, when we looked at the immediate acute effects of the first lockdown, the first 30 days, we found, and this really highlights what Evelyn was just saying about the age and the importance of looking very finely. Not all drivers are the same, and age is a major factor. And in that particular study with the first lockdown, there was a more than 60% reduction for the 80+ driver group, and there was no other age demographic had a similar reduction. There was a smaller reduction in one of the younger groups of 35 to 54-year-old, but a much smaller relative reduction. And so that's interesting. And we hypothesized at the time that the older adults were disproportionately affected by COVID. We knew that they were also more afraid than most people in the population about getting out. So that reduction of exposure was really dramatic. But the work that we're presenting today goes well beyond the first 30 days of the pandemic. That was the data that we had available at the time. Now we have, unfortunately, it's been a very long pandemic, and it doesn't seem to be going away. But this gives us an opportunity to not just prepare for for future pandemics. That's important, of course, but can we, with this natural experiment, can we look afresh at how we do things, how we manage older drivers, how we reduce the risk, how we deal with drug-impaired driving, alcohol-impaired driving, and speeding in a way that builds on the learning that we're doing with the pandemic-induced changes.
I think the one last thing I just add really quickly to that as well is, I wanted to talk about how we use these different measures to look directly at risk instead of just those descriptive things, as Evelyn had pointed out, but she so beautifully made that point that I won't go back to that. But I think we're one of the first studies that I've seen that have sort of turned the lens around to actually look in terms of collision reporting at the data itself and say, people are doing lots of studies to try to understand the effects of the pandemic on what's happening in the real world with collisions and risk. But a lot of them are sort of accepting data as it is. And I think we're one of the first studies that have actually sort of turned around and said, well, how has the pandemic actually affected what kind of data we're getting as well? And what do we need to do about that to move forward?
And that is just a very quick point, very critical. I reviewed a number of studies from the US and internationally about policing and police calls. And international research found that there was dramatic decrease in calls to the police during COVID. Number two, most police services internationally develop protocols and traffic stops was kind of universal, one of the things for police to stop doing. Also, other protocols to not go out for minor kinds of calls is another protocol that went forward. And then there were a lot of police that were also either sick or had to be in quarantine because other people they knew were sick. So there is evidence out there that the system may have been changing both in terms of people reporting, also in terms of policing for these things. So, I mean, it kind of makes sense that underreporting could be an issue.
Yeah, and I want to emphasize that as well, that, this is something that strikes me as really important. And these were my first thoughts on it as well. But just emphasize to any of our police colleagues who are listening, we don't have specific data that anything like that happened in Ontario. We don't know, right? And I think while it's a good hypothetical sort of framework to think about this, and just want to be careful that we don't overstep what we're claiming for Ontario, of course, specifically. Possibility, yes. Data to confirm anything like that is happening, we don't have it.
Well, thank you, and it definitely underscores the depth of this research still to come, and it's great to see that Canada is a leader in some of these reportings compared to the research that's out there. We are just about out of time, and I have one more question here. It's kind of a two-part question, or two questions that I'm just going to roll into one. And my apologies for the pronunciation. I'm not a statistical analysis wizard, but the question reads: given that your interruption points were very closed, 3 interruptions in 2 years, what about spurious associations due to collinearities? And the second part of the second question reads: is it reasonable to think that the pandemic has not impacted the denominator of ratio outcome measures?
These are great technical questions. I love these because I'm a bit of a nerd. But yeah, no, you're right. I mean, about the interruptions being so close together. Like, for example, when we looked at the 2 interruption covariates in 2021, they were right next to each other. Essentially, the way we dealt with that is we just, we assumed the interruption could be one or the other, but not both. Right. And so we would just use, information criterion to see which way the model would fit better, whether we assumed the interruption was the first one or the second one. And always we would fit the interruption covariates individually first as well. So, I mean, we did our best with it. There's definitely an issue there. We tried to be really careful. In terms of denominators, yes, that's absolutely correct, but we would assume that the kinds of denominators we were usually using would have been affected mostly by changes in exposure as opposed to other pandemic related changes, like changes in riskiness of drivers. I'd be happy to have that conversation with whoever's asking offline in more detail, but I think it could be a pretty long conversation, and I know we don't have much time left, but please reach out if you want to chat. That'd be great.
Yes, and with that, we've reached the end of today's webinar. I'd like to thank our today's panelists, Evelyn, Patrick, and Mark. Thank you so much for your taking time out of your day to explain this to us. There's obviously that we could talk about this for a long time, and I'm sure there's going to be some more research coming out soon. I want to note to the participants or the attendees today that you'll be able to see a copy of this presentation along with the recording. And to all those as well, I'd like to point out that we try to hold these webinars monthly, and there'll be another webinar for CARFs coming up in March. Please stay tuned to our emails and website in order to see when and where that's going to be. So one last time, thank you so much, Evelyn, Mark, and Patrick, and I wish everyone a good day.
Take care, everyone. Thank you.